Hi, I'm Dr. Nitin Khag, consultant plastic reconstruction and cosmetic surgeon. So, continuing our plastic surgery info shots on scarring, there's one more question which I commonly get from a lot of patients saying that after surgery, what should we do to make the scar look very minimal? So, my advice would be first, the main enemy, the biggest enemy of a scar is sun. Sun rays are so hazardous that they can make the scar look very ugly. They can make it look darken, make it cause hyperpigmentation. So you have to mainly protect your scar from exposure to sun rays. So if you have to go out, then you can put on or apply some sunscreen lotion. Anything above 30 SPF should be okay. So to prevent the scars from the hazardous, or to protect the scar from the hazardous effect of sun rays. Other thing is massages. What happens is scarring just not only happens on the skin, it also happens inside the body where the surgery has been done. So lot of scarring happens, so the skin starts getting stuck up or gets tethered to the underlying structure, which makes the scar a little depressed or makes the scar a little stuck up, and it becomes a little more prominent. So what we have to do is have to do gentle massages. So massaging of the scar is very important, and massaging is not just for once or twice a day. You have to do a lot of times, like 7 times, 8 times. You're sitting watching some television or some series on the TV. You have to keep doing massages so that the scar breaks down and the skin starts becoming loose. So that makes the scar looks little less prominent. Other thing is putting some pressure garments. Sometimes what happens is, if you notice the scar becomes a little broader, a little thicker, and then you require to do massages with little pressure on the scar, so that the swelling kind of a little bit starts subsiding or starts settling down. You may require some compression garments, which is custom made, which puts a lot of pressure on the scar so that the scar doesn't start swelling up or doesn't start growing. It is put under pressure, so it becomes flattened out. But yes, you have to show it to your plastic surgeon, and he would further advise what to do. So these are the basic things which is really required to do it, and you have to religiously do under of course the guidance of your plastic surgeon, so that the scar will become little minimal and it will become less conspicuous. And then whatever little bit scar here and there remains, or a fainter thing, then you can just do laser or something later on. That treatment can be done later. So this was something about scarring, and what would be if you have any other questions, you can just inbox me, or you can comment right in the comment box, and I will address it. Thank you.